So it really dominated programming throughout the day. It was a MAHA meltdown on Capitol Hill. Can't say it was surprising either. Yesterday, this took place on Thursday. Furious Senate Democrats and some Republicans lectured Health and Human Services Secretary RFK Jr. over his recent action on vaccines and the overhaul of the CDC. But he gave a lot back.
Yeah, he did. Kennedy testifying before the Finance Committee, defending his 7-month tenure. He argues the agency failed Americans during COVID and allowed chronic disease to make the United States the, quote, sickest country in the world.
But Democrats did not let up, demanding RFK Jr. resign from his post or be fired by President Trump for what they call his reckless disregard for science. But Kennedy's boss is standing by him.
He's got a different take, and we want to listen to all of those takes. But I heard he did very well today. But it's not your standard. It's not your standard talk, I would say, and that has to do with medical and vaccines. But if you look at what's going on in the world with health, and look at this country also with regard to health, I like the fact that he's different.
True, and he is different. Now to some of those tense moments at the healthcare hearing that quickly turned into a shouting match. Listen closely.
Robert Kennedy has elevated conspiracy theorists, crackpots, and grifters to make life or death decisions about the health care of the American people.
We are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening?
On behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time.
Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
that's the problem, is that they didn't have the data. The data by the Biden administration, absolutely dismal. I never promised that I was going to recommend products with which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Ooh. Got really heated. I loved that line when she's criticizing him and he says, but you're taking almost $1 million from the pharmaceutical industry. I liked the line when he says, you've been there. They're saying you've been here for 7 months and you can't tell me the data. And he tells one of the senators, you've been here for 20, 25 years. And chronic disease has gone up 76%. And when he was on the couch with us, he said 1 in every 34 children has autism, 1 in every 22 boys. He said 1 out of every 3 kids is diabetic or pre-diabetic, and it's costing us $4.3 trillion each year, which is our biggest expense, and it's 5 times our military budget.
So I guess the most frustrating thing about the entire hearing is that there seems to be zero curiosity on why we're such a sick nation.
Correct.
And what's going on with the food. And I'm not saying to have overall or sweeping, changes when it comes to vaccine, but I do have some genuine curiosity about the science about each vaccine.
Yes.
And it didn't seem like they were trying to get to the bottom of it or even hear him out. They came with a lot of prepared, scripted moments for viral TV moments.
Right, and it was frustrating because I liked, for example, Senator Cassidy. Senator Cassidy, doctor, right, Republican, up for re-election. He has like 7 or 8 great questions. He doesn't wait for an answer. I wonder about this. I wonder about that. Okay, let him answer each one. He could have been concise and right to the point. He was calm. He didn't lose his mind. He wasn't looking for a viral moment or to try to get on CNN a little bit later and wasn't trying to raise money. We have some legitimate testing. He's trying to say, look, I came here to revamp an agency that was not doing well. Right. You think it was doing well. The American public doesn't. And I'm looking at the stats. I would like to know why we're having. I used to have 3 vaccines. Now we have dozens of vaccines. Can you show me a study against a placebo why this is effective? Can you tell me about the velocity of the vaccines, why they need them all at once? I'm looking at that. The fact that I'm looking at that bothers you. And when you want me to go over testing, there isn't testing done. And we just brought back, he's got a few things. Obesity is a huge problem. What did you guys do about it? We have 75% of America's youth can't can't qualify for the military. What did you do about it? During the pandemic, out of industrialized nations, we did the worst. What did you do about it? Why do you want to rest on your laurels when there's no laurels to rest on? I'm coming in trying to change things. Maybe you could ask me questions that you don't assume you have the answers to. Our pandemic reaction wasn't strong. COVID-19 vaccine, he said, I understand how we did it, what we did on doing it. But if you look at the other after effects, we haven't done a study on it yet. So why do I want to mandate COVID-19 vaccines on a study and give it to infants that Joe Biden wanted to do? Why would I do that? You could yell at me all you want. He's got trouble getting off quick responses because of his breathing and his voice, so it made it tough. But man, was he ready?
Well,
Yeah, he was.
first, I'll tell you, as a mom, I'm going to make decisions about the vaccines. I don't necessarily trust everything the government says because of what happened under the Biden administration. They told us if you get a COVID vaccine, if you get the boosters, then you're not going to get COVID. Well, we found out that wasn't true. It was all a lie. So as a mom, I'm going to decide what my child gets. She's going to get the basic ones, the basic vaccines that her doctor recommends. That's who I trust.
But what if your school turns around and says, I want more?
Thankfully, ours didn't. Ours did not. And I held out till the very end, and then they did away with all of that. So there were a handful of us that didn't want our kids to have the COVID vaccine. That was my choice as a mom, because we interviewed so many kids. The kid who played soccer out on Long Island, who had a heart problem, can't play anymore, and his parents thought it was because of the vaccine. I just heard so many stories like that. I made the decision for myself. But like you said, the vaccines, that's one topic. The foods, that's another topic. And when you have these senators who have been there for decades and decades, and we're seeing chronic disease go up, we're paying so much money for people who are sick down the road. When I could list 10 people that I know personally that had breast cancer in their late 30s or their early 40s. Why is that? That didn't happen when I was growing up, when my mom's friends were raising their children. So I have questions about the foods. He said there are 1,000 ingredients in our foods here in America that are illegal in Italy and other European countries. So let's get them out. He said that the food companies know this. Fruit Loops, he said, for instance, there are 2 different types of Fruit Loops. They make one box for America, they make one box for Canada, because they don't accept the dyes in other countries. So why don't we have those same standards? That's what I'm excited about MAHA for.
We don't have the standards, but also we learned this through COVID, and we also learned this from RFK yesterday. We don't do the testing. We don't do our own research. We keep citing studies from other countries. Why is the world's richest country, the most prosperous country, not doing their own studies?
Right, and why is the FDA taking so much money? Why the agriculture community and the pharmaceutical community, they pay so much money into the FDA? Well, the FDA is testing those products. So can we trust those studies? And that's what RFK Jr. is talking about. And when he says that Elizabeth Warren is getting what was the number? $855,000 from a pharmaceutical company, of course she's going to be negative against RFK Jr. because he wants to change all of this.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.